We're live. Joining us today is Winston Damarillo, the founder of DevCon and the CEO of Talino Labs. Sorry. And today is a live stream to help our loyal followers learn more about the RapidPass system. And before that, let me do a bit of a background so that we can put some context on what Winston is going to discuss in a little while. And so let's start by comparing how well or how poorly the Philippines is doing in terms of COVID cases. And so this is from a site called cashin.ru/virus/countries. And we took a snapshot of several Asian countries. And you will note that the word health is indeed justified to say that the Philippines has among the highest, if not the highest rates in Asia Pacific region. And so you can see over here on my mouse that this is the Philippines. It has never gone down and it has always been on the up and up. Now, if we compare this to, let's say, Singapore, Singapore was hit with a bit of bad luck. A complex of dormitory was hit, and 200,000 to 300,000 dormitory workers that were cramped together got infected. And so this is why you see such high numbers. But then they got their act together, and with aggressive contact tracing, testing, and treating, you will see that despite the high numbers, it's really starting to go down. Not to mention Korea, Malaysia, Taiwan. All of these countries have managed to bring their case levels down. And this is updated as of this morning. So we might ask, what's the difference? And I put it to you that the difference is really in contact tracing. Up to now, we've been asking the authorities to please publish the percentage of contacts that you have quarantined in the first 3 days of notification. The nearest that I got was something like 87% were contacted and quarantined. But that wasn't within 3 days. I suppose it was after 1 week, which is useless by that time because the disease would have spread several generations with the delay. And so we've been talking to Winston Damarillo and his RapidPass system on how this system can help local government units shorten the time it takes for them to rapidly and assess, identify, and quarantine all the close contacts of suspected COVID patients. And so this is a rough concept idea of how I think RapidPass will work. This is the person that may have been infected. RapidPass, I think, would be having check-in data as to where this person has been to. He will also have data as to where he's been living, residing. If he takes a plane or a boat ride, all this data are then aggregated together to quickly come up with other people that may have been in danger by reason of close proximity to an infected person. And with that as a background, let me give the floor now to Winston. We'll also have data as to where. I will stop my sharing.
Great. Wilson, thank you. Thank you for having me as well. And thank you for your vigilance in this. No, I know you've always been talking about contact tracing, and I agree with you. And I want to add a little bit to your perspective. Not only do we need to have effective contact tracing, it has to be multimodal. In other words, we have to use all tools available to us, whether it's Bluetooth or ultrasonic frequencies, or very simple text messaging and QR code and positional contact tracing. We kind of really need to put them all to bear in some coherent fashion. So I'm also a really big proponent of unifying as many tools as we can get our hands to into a common data format, into a common place, so we can, make all these digital bayanihan naman of all that apps together, no? So that's really kind of what I would, along with you, advocate, no? So I wanted to present today other aspects of this multimodal approach to our pandemic response. And then there's two parang mag-aanak na solutions. So for today, I will talk about RapidPass, which is intended for quarantine management, and SafePass, which is prevention and incident management technology that we've brought out and have presented to IATF, and actually their IATF identified solutions. So I'm gonna quickly just step over to where we are today when we're beginning to reopen. No? So we have extended our GCQ here in the Philippines, and I know in the minds of a lot of people, let's get the economy back on track. And so the state of the art today is like, what do we do to protect health and enable businesses that are slowly reopening to do it as safely as possible? So I'm going to start with that, and then I'm going to roll back a little bit on what we did during quarantine time and how we can still replicate some of it in specific hotspots here in the Philippines. So if you allow me, no, and then I'll just very quickly finish this slide so we can have these conversations, no. Because I really I'm curious of not just kind of the general thought, but also the technology behind it. If we have time, we'll geek out quite a bit as well. So I'm going to start with a quick video, which is the situation of today and the technology that we're deploying to address that. But as you said, we're not out of the woods yet. We're still climbing out. Then roll back a little bit on what we have done in the past and what we can do more with that. So with that, let me go share my video really quick. Here and play it. So this is SafePass technology. We co-designed it with DOST, DOT, and DTI, and this is intended for helping economy.
New normal, mapapaisip tayong mga negosyo. Paano magiging ligtas ang ating mga employees at customers? Paano na ang social distancing? Paano kung may ma-infect sa trabaho? Are we ready for this? Buti na lang may SafePass, ang all-digital at contact-free system na kapartner natin sa safe na pagbubukas ng ating mga negosyo. Sa SafePass, kayang mag-set ng daily capacity at visiting schedules at gumawa ng automated incident and contact tracing reports sakaling may infection sa establishment. Safe at convenient ito para sa atin. Para makakuha ng SafePass ng inyong employees at customers, kailangan lang nilang mag-register at gumawa ng profile. Mag-book ng time slot para di na pumila sa labas, at mag-transact ng panatagang loob na may safe distancing regulations, secure and confidential ang kanilang personal data, at tatawagan sila kung may infection sa kanilang time slot at location. Operating in the new normal comes with new challenges, at ang SafePass ang susi para maibalik ang tiwala ng mga taong bumubuhay sa ating mga negosyo. Let's go and reopen the economy safely. Visit safepass.asia and get started today.
So that's the technology that we're already currently deploying. But as you said, we're not out of the woods yet. And I know we did that just so we can get going. Pero let me go back.
When you say deployed, where is it currently deployed?
So,
which LGUs?
So we actually deployed it in 3 departments first. It's in DOT, DOST, and DTI. And the SafePass technology was used side by side when we allowed our restaurants and hotels to reopen. So it was actually deployed in establishment. And if you notice, Wilson, this is not an original idea. It's a Filipino implementation of a Singapore-known idea, the safe entry, right? And so, alam ko na magbubukas na rin lang naman yung mga negosyo. Let's go protect them. So there's really, in this conversation today with you, there's really parang 2 technologies that I think is something that we already have that we can already use to complement a few of the things that we still yet to do. No, so magkakambal yan. So RapidPass, we built so that we do good quarantine management because that was what's needed, and that's still needed in some areas in the Philippines. So that's to keep people home and to put critical frontliners out safely and with contactless mechanisms. The other side of the coin here is when you leave the home and you enter establishments, malls, restaurants, LGU offices, or even public utility vehicles, then we need a mechanism to provide prevention, which is the health check, to positionally contact trace. So there's multiple ways of contact tracing. SafePass is a positional contact tracer, meaning it will have a QR code, there's a monitoring point, you proactively point to that, and to provide incident management. And this is to your point of narrowing the response time when we see an infection.
Yeah.
Problem is our response time. It's really difficult and it's really, not quite where it needs to be. So dalawa siya, magkakambal, no? So I'm going to start with RapidPass because this is the first thing we did.
Are
The
both of
first
them
tool-
free to use?
Yes, both products are free for use. RapidPass is actually not just donated to the government, it's also been open sourced in Apache Lab software. So a lot of people have actually improving it now. And there are people in Africa are even trying to leverage and reuse it. And we're already exploring other uses of RapidPass. So RapidPass is open source. The SafePass was made free to use for in partnership with DTI and DOT para sa mga negosyo. So RapidPass was rapidly built. This was an initiative of the IATF. So hindi ito na naisip ko tapos pinush namin sa kanila. IATF actually said, anong gagawin natin? We have 12 million people that needs to stay locked at homes. We have 1 million or 2 million people that we need to allow to be outside of residence because they're critical providers of services and frontline for us. And we need to produce the ability to let 2 million people roam with the approval of 32 different government agencies at the same time. And we need them to pass through 180 checkpoints. So that was the challenge we had in March 20. And we needed to fix that problem. So we created RapidPass. We're a little bit unique in this. We draw some best practices in Wuhan, China, in how they were able to leverage properly QR system and then deploy it as a system, not as a single app. So that's what we did. So simple mechanics. Unang-una, people can apply from home or businesses can put it on a spreadsheet to apply to be able to traverse out of quarantine zones. So this can be used when we did ECQ. It can also be used as a quarantine pass in areas with hotspots. And I'm speaking on places like Cebu at the moment. We really need to control who's able to get out for the moment, no? And it actually did work here in NCR, and hope they can do it. So, una magpapaalam ka, you need permission to leave the home, and then there's an approving agency that lets you get out of the house. It could be an LGU na barangay, and that process of approving instantly gives you the ability to get a QR code on your text or on your email, and then you can print it. It's specific to you, or you can keep it on your phone, right? And then the complementary counterparts of that is enforcement. It needs to be then have a back-end system where checkpoints can then verify if it's a valid QR code and your validity of being out of the home is there and in the right source and destination vectors. So, and we want to make sure we deploy this fast, quickly, and internet resilient, meaning pag nawawala ng internet, kakadaan pa rin. So we actually created a mechanism where there's micro synchronization of the data of allowable QR codes on the phone. So we can use as much of our knowledge here. Gawang Pinoy ito. So we did this from that perspective. So it was a very well thought of by about 1,000 volunteers from DevCon. When we asked for help, 1,000 people signed up. We had design people, we had lawyers, we had legal health professions. So how does it work? So we actually produce a cryptographic QR. So the QR we use in the Philippines, cryptographic. Pag binasa mo yan on a regular QR reader, you just get gobbledygook. You can't understand what it is. So that cryptographic QR allowed us to put critical data payload into the QR. So instead na mag-check pa ng mag-check sa internet yung mga phone, yung payload nasa QR na, pero it's encrypted. So that's how we were able to deploy this in millions very quickly. Number one. That corresponded to a crypto decoder on the checkpoint device. And then on the card itself, it was actually designed as if it's a passport, no? So it will tell you na ito yung approving agency. Is it the barangay? Is it the LGU? Is it PNP? Whatever. It provided a validity period. So hindi siya forever. Now, it gives you a validity period for your pass. It gave you permitted destinations. And then the pass itself can be enhanced or revoked instantaneously. So yun yung ginawa natin, no? So this allowed us to enable rapid passage of people, PNP. The other thing I should say, Wilson, hindi lang to technology, it's also process. We had to work with, approving agencies, DICT, PNP, LGUs, right? So that's what my advice to everyone. It's not just tech. You have to coordinate the entire ecosystem in this. So we were able to deploy RapidPass that way. And this is kind of what we've learned from it. Now, it did enable contactless verification of people outside of home. It was convenient. People have embedded it very quickly in their day-to-day. Yung mga frontliners, they know where to put it. And the cops, the PNP, were able to then efficiently monitor people outside. So it allowed people's passage, but it can also be used as contact tracing because we store every single data set on the phone. And the most important people during a lockdown or ECQ are the ones you allow out. So we can actually track people we allowed out and see where they are at any given time. But it's positional, no? It's not GPS and it's not Bluetooth, but we have it, and we have it in large census. Meaning
So you can
more.
So you're saying that you can track based on the checkpoints that scan the particular holder of the QR code.
QR code. And this is why, in complement to Novid or Trace Together or Stay Safe, it would then be very effective now if we only had a system that combines all the data together.
Yeah.
So this is, and then this one worked. It's been successful in the NCR. We've now extended the RapidPass usage in the NCR to December, and we're offering this to be used in any other LGU. It's tested by.
So in this picture, Winston, I see that even people without mobile phones can use your QR code system. They just simply need to print the QR code.
Correct. Yeah, they just need to print. Kasi, we have to adapt now. We're the Philippines. We're still, not everyone still has smartphones, and sometimes they don't have internet. So we want them to print their pass at home, laminate it, and then use it as they go. The police naman, PNP, they just need to download allowable people in the morning, and their database is already renewed. So kahit mawala yung internet nila on the field, they can still implement.
And so for an LGU like, say, Dagupan City, that needs to make sure that people under quarantine are not allowed out. If these people were to apply for a pass, they would then be denied.
Correct. If they have no reason to be allowed on a pass, or if we rotate people, no, pag binigyan mo lang siya ng validity period na Wednesdays ka lang, Thursdays ka lang, Friday ka lang, it allows us to disperse people that are in circulation. So that's really quarantine management, no? And we needed to do this because we lockdown is the only thing that worked for us so far. No, we needed to improve other things, and we can't be locked down forever.
So
but
question,
we need to make sure.
Yeah. So question, Winston, on the side of the LGU, do they need to have updated list of their constituents or residents in their locality?
Yes, they have to. And the good news there, Wilson, no, two things. No, other project we did Relief Agad, which is the amelioration. Yung mga tao na mahirap hanapin, hinanap na yan ng LGU because of Relief Agad for the ayuda. And people that are not hard to find, they more often have already registered and they have smartphones and they can register. So kailangan lang gamitin ng LGU what they've already been using. They've already been collecting names for amelioration. And they probably already know the rest of their citizenship. Then it's a good time to get to know your constituents even better. And so this provides an efficient way to do that.
But then I know of some LGUs that still haven't gone around to digitizing their resident list. So what do we say to them?
Well, I think it's also a good time to get your residents to self-register. No? This is another way to do that. No? Kasi kung better than pipila ka pa dun sa barangay mo
Right.
or pipila ka pa sa LGU, apply from home.
Apply
And
from home.
and Wilson, we have 100% contactability because the QR pass is only delivered via SMS. So ibig sabihin kung wala kang phone, hindi mo natanggap yung SMS, hindi ka magkakaroon ng pass.
So you are in effect able to validate the cell phone number.
Correct. So there's
right?
contactability. Oh.
But then how do the LGUs make sure that the people that self-register are actually residents of their community?
There's two ways to do that. Number one, they can request for home-based CDR for the phones kasi alam mo naman kung saan ka natutulog. So
Okay.
that phone number actually locates to the tower closest to where you sleep at night. So that's one way to verify. Number two, I think it's really a good time for the LGUs to actually know the mobile numbers of their constituents, especially in an emergency for notification period process. So meron namang different ways to verify it. The final thing is you can OTP a resident and you can take that OTP verification to your barangay, and it's a better way to verify than papel-papel, diba? So that's what we're doing with RapidPass.
So not everybody may understand what the OTP means. Can you elaborate for our other listeners?
Sige. So in order to verify na sasayo talaga yung telepono, the system will send you a password.
One-time
OTP
password.
stands for one-time password. So hindi mo siya pwedeng ipasa, hindi mo siya pamigay. So when you apply for a pass, it will verify your mobile phone by asking you a one-time password to repeat back what you received on your SMS. So pag inulit mo yun sa app, it verifies na natanggap mo talaga yung OTP sa telepono mo. So this allows also people na kahit wala silang smartphone, pwede silang mag-apply sa smartphone ng kapamilya, kapitbahay. Pero kung bine-verify na kung ikaw ba talaga yan, pupunta yan sa iyong cellphone kahit hindi siya smartphone. So that's how we actually used it for Relief Agad as well, na makikigamit ka ng smartphone kung wala ka smartphone para ma-print mo yung QR pass.
So how would this work? In theory, the LGU can print out a series of OTP and deliver it in mass or in batches to barangay captains?
There's a couple of ways to do it. No, unang-una, we can simply inform the barangay, the citizens na go apply. 60 to 80% normally have their own way to apply. At tapos yung mga 20 to 30% na nahihirapan or walang smartphone, they can go to shared facilities or they can use their kapitbahay to help them register. So yun yung experience namin, Wilson, over 20 million of amelioration recipients. Kung walang smartphone, nakikihiram lang sila. Pwede din ganun.
So you're saying it's now confirmed to be working in a Philippine environment for you now
Correct.
have over 20 million registered users for Metro Manila alone?
Ay, hindi po. Yung 20 million was for the Relief Agad. We built 4 systems for the government, no, and we shared our learnings across the four systems. Itong RapidPass is actually only used by about 1 million people today in the NCR. Pero I think that's bigger use case than any of these LGUs that are needing one right now for Upwork. So we know it works at that scale. And we know that we can give it to the hands of all Filipinos, hindi lang Filipinos with smartphone and internet. Kasi yun ang importante.
Yeah. Nice. Nice. And kudos to all the volunteer developers that sacrificed and volunteered their time and efforts to create this. Go ahead, Sir Winston.
Sige. So this is the one that keeps us home during quarantine. And yung kakambal naman niya na system is called SafePass. So SafePass has 4 pillars to it. Ito naman, Wilson, ito yung ginaya talaga natin sa Singapore and we added a little bit more, no? We studied Safe Entry of Singapore and Safer Me in New Zealand. And we noticed there are 4 pillars. when we reopen our businesses. Unang-una, you need safe space planning. Pag sinabi nating GCQ, you only have 30%, that's 30%. So that's the first pillar, is we need to plan our space. The second is we need to automate our safety questionnaires. Kasi with paper today on our safety questionnaires, not only is it not efficient, it's a transfer conductor of the virus, where we share the ball
Yeah.
pen and the paper for everyone.
Mm.
It defeats the purpose of health checking. So we want that fully automated. And it again doesn't matter if you don't have smartphone and you don't have internet. Pangatlo, may protocol na binibigay ang gobyerno. We have to follow it. So we need to have protocol enforcement. And then finally, I think this is your favorite topic. When there is an incident, we need to have extremely good response time. And in order to have extremely good response time, we need to almost pre-format the analytics around contact tracing.
Yes.
So we actually do that with SafePass. No? So yung apat na yun are the pillars.
Can
Go
I
ahead.
ask about the protocol enforcement? Can you go back?
Sure.
So, like, I've heard of stories around from China where there would be gatekeepers in each establishment, and before they allow people to go in, they will scan the QR code. And if the person has been either infected or a close contact of somebody that is infected, the system will notify the gatekeeper and prevent entry. Therefore, the virus will not spread in the community. Is it the same with SafePass?
That's the whole point. That's the whole point. Because we
So-
wanted to make sure that you are not identified to be a risk, that you have attested to your perspective on your health, right? And with the new rule in the Philippines, pag nagsinungaling ka doon, that's a criminal offense. No?
I
So
didn't
it's
know
the-
that.
it's-
What's the penalty if you are caught lying?
You are caught liable for people that you infect within the establishment, and the establishment owner is liable for not doing their due diligence to ask you the question.
So that's the law.
Yeah,
I didn't know
kasama
that.
Kasama yan sa ating requirement, kasama yan sa protocol. Kaya yung mga ina-allow na magbukas, they're really asked to ensure na yung safety, kasi kailangan natin lakas ng loob magbukas ng negosyo at tiwala na pumasok, di ba? So if we don't restore that confidence, may hirapan yung ating mga businesses. So the DTI, DOT, DOLE, DOST, DICT, they're focused on making sure that.
So this also means that if a local government adopts SafePass, all the participating establishment will have to have a mobile phone configured to be a part of the protocol enforcement.
Correct. And that way you have a very good view of your LGU from the moment they leave the house with RapidPass through the point they stop at the checkpoint and all the way as they enter an establishment and back home. So now you have positional contact tracing. Kasi ito yung pwede natin gawin as an emerging country.
Yeah.
We don't have Bluetooth for everyone. We don't have ultrasonic capability for everyone. We might not have internet for everyone. So a very clever use of QR is important at this point, and text.
So I think we both know Sir Max Limpag from
Yes, sir.
Cebu also, right?
Oh,
So we see his post about how ineffective the Cebu QR code system is, and seeing that you guys are from Cebu, how come Cebu is not adopting the SafePass system? It boggles the mind.
Oh, it's not just disheartening for me, it's infuriating as a geek. Karamihan ng SafePass mga ginimo ni sa Cebu, mostly from our developers that are working in Cebu. Pero syempre, and it's not only a best practice from around the world, it passed our national IATF vetting and rigor. So, baka lang naman kulang lang ng information, Wilson, baka kailangan na nating tulungan ng LGUs to say that it's here, it's made by us. Gamitin natin, and it's free actually. So,
yeah, I know of other LGUs that are still on pen and paper system. So I wonder how scalable it is, with the notable exception of Baguio. Baguio has their own system, and kudos to Mayor Benjamin Magalong for instituting something, the gold standard. Everything that's a gold standard they did. So,
Yeah.
I hope you guys remember in the coming elections who really worked for your health and safety. Don't keep on voting those people back if they can't protect you.
Yeah. No, I think people that are more in tune, no, kagaya ng ating governor ng Bohol is already thinking about an integrated system. Ito yung integrated system eh. The quarantine management, the incident response, the contact tracing, these are integrated systems na marami namang best practice around the world. Kailangan lang gamitin eh.
May tanong naalala ko, may tanong po yung city administrator ng Dagupan. When I shared the SafePass system with him, tanong ni Sir Vlad Mata, pwede rin bang gamitin yung SafePass sa public utility vehicles so that they can track who rode on which vehicle on which day and time?
Opo, meron tayong ginawa. Actually, we designed it for the bus systems and the PUJs na kasi ang hirap naman na ipapalagbook mo pa yung driver ng jeepney, di ba? Kukolekta na nga siya ng pera and then magpapalagbook pa siya. So what we did was we emulated a system where the moment you enter the jeep, you text the plate number of the jeep.
Ite-text.
And ite-text mo lang, oo. And then the moment na natanggap meron kaming intelligent responder ng text na confirming that I've received your text. I know your mobile phone already because you sent me a text. And I know where you rode from and I know where you get off. So ganun lang, text in, text out.
I'm worried about the cognitive effort required to do an SMS. Would it be possible to use the newer OCR method? Just take a picture of the license plate and then OCR mo na lang yung plate number. So you
Actually,
don't even...
Actually, we started with that, Wilson. Pero to be honest, mas sanay yung mga Pilipino.
Mas sanay yung tao na mag-SMS.
Oh, mas madali sa kanila mag-text ng 7-digit plate number, space, time. Yun lang.
And guess what? Mga LGUs can now use the data to verify compliance with yung mga safe distance inside mga public utility vehicles. And once that is proven to work, I see no reason why they should keep the jeepneys and minibuses on the sidelines. They can now restore the transport system. Or is it just me?
No, it's what it is. I think it's just a matter of implementing it. No, kasi while we follow global best practice, we have to understand the Filipino environment and situation as well. Lahat tayo nagte-text eh. We use text quite a bit. And people are, mabilis lang yung text. And now it's also inclusive. Kasing sumasakay sa jeepneys are the ones that typically also don't have smartphones.
Basic phone lang. Basic phone lang sila.
Isipin mo, you just text plate number,
paano kung
space.
hindi nila maalalang gawin?
Yun lang, kailangan lang natin paalala. Kasi, it's not just helping the government, it's to their benefit also, di ba? Kailangan na sabihin na, kasi kung merong infection coverage yung situation mo, i-inform ka rin naman namin. So I think people need to know there's a benefit for texting, hindi lang siya obligation.
Sayang lang, I really invited several LGUs to attend and hoping that they could catch your presentation and see all the benefits the SafePass system brings so that they could come on board and adopt your system. But sadly, none of them showed up today. Which by itself is another statement. Sayang. We won't name you so you won't be shamed, but you're doing a massive disservice to your constituents. Sayang kayo.
But keep asking us, we'll keep reaching out to them, Wilson, kasi problema natin lahat to eh. So we'll keep reaching out. But it's just these are all the systems we do. We do capacity planning for establishments para hindi ka lalagpas dun sa safe capacity mo. We do scheduling and schedule management para alam mo you're within your quarantine time. We actually then
so pwede rin gamitin yan para sa mga dental appointments, doctor's appointments. So they are automatically scheduled. So parang queuing system na rin yan. And for free ba ito or ito yung pang-corporate na may bayad?
No, for small business, it's always going to be free. Yung mga large conglomerates have been paying for it, so it's okay. Pero
Okay.
yung may mga SME and DTI is creating a parang registration, free registration for all of them. Kokontak lang sila sa DTI or sa DOT if they're in restaurant
So,
or hotels.
alam mo, Sir Winson, having seen what your system can do, it boggles the mind why the adoption rate is not as high as we want. From your vantage point, what are the top concerns ng mga LGU? How come they're postponing or not yet adopting this type of system in their localities?
Alam mo, Wilson, I also understand the situation of our LGU. Ang dami nilang iniisip ngayon, no? Meron silang public health, meron silang ayuda, which I think eats up a lot of their time. And we just need to reach out to them. Ang sana lang, ang request ko sa lahat is, don't worry about not invented here. It's invented by all of us. Gawang Pilipino to. We should all just, parang hindi naman kailangan sarili-sariling flavor. This was built for the Philippines by Filipinos. And honestly, Wilson, okay naman ang adoption ng RapidPass tsaka ng SafePass in the private sector. So sana naman para lang integrated, matulungan din natin yung LGUs. But we're actually doing we're growing quite dramatically. We're already building a second version of SafePass sa dami ng mga business users namin ngayon. Mabubuo po natin yung ating Philippine-style positional contact tracing goal kung lahat tayo gagamit nito.
So maybe instead of reaching out to local governments, we might as well reach out to the chambers of commerce.
Yes.
Sila na lang.
Yun.
Diba?
Yun ang Association of Hotels, Association of Restaurants have been
But
super effective for us.
But if they did this, what type of resources do they need to commit or dedicate to make this work?
The most important resource lang na kailangan is a phone.
Phone.
A smartphone.
Doon sa gatekeeper yung mag-i-scan.
Dito sa enforcer natin.
natin.
Pero ano lang yan, we tested the cheapest phone, the Cherry Mobile Flare, which is only 2,400 pesos. Pwede na siya. It works. It works
great.
really well. And so for, something like $40, you now have a digital enforcement platform for at least positional contact tracing. And then it already allows you this parang when an incident happens, and an incident will happen, kasama na po dyan yung compilation and correlation systems, kasama na yung automatic notification of impacted customers and employees.
Sige.
Kasama na dyan yung reminder ng mga enforcements.
Sir Winson, go ahead with your slide. I'll just be away for a minute. Bye-bye.
No worries. Okay, so incident management AI is something that we provide. It allows you to compile, correlate, and possibly enable contact tracing. We also created a system so that they can auto-notify people para mabilis yung response time. If there are protocols that is governing your particular industry, we will implement protocol enforcement guideline, yung re-rostering, yung quarantining, shutting down sites, reopening parameters. And then all of this will have a reporting audit trail so that when people need to then report an incident, and all the data sets already in one place. So it's been broadly used. This is one example. Actually, SafePass is being tested aggressively in Intramuros. When we open Intramuros, it will have SafePass in it. Madali lang siya. That allows you to scan before you enter the facility. When you scan, you will be asked the safety questions. It's intended to be one-hand operations. So yes, no, and sliders. And then you present your QR code to the enforcement scanner that will allow you to pass and allow you to continue on your visit to an establishment. And then kung wala namang smartphone, there's actually paper with a QR code that covers for some people that may not have a smartphone. So that's it. I think this is the platform that we built. It's called SafePass. It's a combination technology of really the ability to register yourself, request for time in a specific venue, be tested against protocol, both for your health and safety and the capacity, and then be monitored for possible contact tracing. And then that allows us then to parang increase the ability and response time of businesses and LGUs when there is an incident for COVID. So yun lang, Wilson. Thank you for the time. I really I haven't seen these two presented together in a while, so thank you for giving me the opportunity.
Thank you also for sharing with our readers and loyalists here. Let me open the floor to some questions from our Zoom audience. I acknowledge the presence of Sir Kevin Byrne. He's with the United IT Group Pangasinan, and he's a former U.S. Marine and security professional. Let me unmute you, Kevin. Do you have any questions for Sir Winston? Or Sherwin, Aldana, and all the rest? Do you have questions?
Yes, sir.
Good afternoon, Sherwin.
Good afternoon.
Any questions for our guest of honor?
Yes. Sir Wilson, salamat sa sa link, and congratulations pala kay Sir Winston Damarillo, sir. We feel you regarding po sa LGU adoption.
Allah.
Because we have a similar system din. Actually, we submitted our proposal last March 30 sa IATF. Hanggang ngayon, wala pang approval. So, nasa DOH na, wala pa rin.
Oh no, yeah.
So, actually, may similarities yung system na ipasa namin. We have been approved by the UST also. Yun nga lang, we're being funded by by 2 barangays lang for pilot testing. So, yung direct ko na yung question ko, sir, yung paano nyo mini-maintain yung cost ng system since na free yung yung deployment nyo? Paano nyo mini-maintain?
Yeah, so thank you for that question, and thank you for reminding me. When we built the system and when the IATF adopted it, we were blessed that we had 2 very large foundations support it right away financially. Si Manny Pangilinan, the MVP Group and PLDT, as well as TECC and the SM Group and BDO, really provided the financial backbone for us so that we implement. We gave away 500 phones to the checkpoints, and we ran the system at the best possible environment we can. We also got help immediately from Amazon, AWS, and Microsoft Azure. So not only is the system run at high scale, it's also running at high redundancy. So we really treated it as a national critical infrastructure when we built it, and our geeks got the opportunity to build highly resilient, highly scalable systems. So nagpapasalamat kami kay BDO and kay PLDT, and then all the volunteers of DevCon really worked day and night after that to then make sure the system is working.
Kevin, would you like to jump in? Yeah, thank you, Sherwin, for your question.
Maraming salamat po. Mabuhay po yung stay safe, tapos safe pass
Wala kaming kinalaman sa stay safe. It's RapidPass and safe pass.
Yun yung isa ko sana, sir. Pwede pa ba, Pwede pa bang mag-accept si IATF ng mga additional contact tracing systems, application, since na sa issue ni USEC?
I think we could always use as many contact tracers as we can. I think it's important lang before that happens that we have an aggregator system. Otherwise, it will confuse the citizens. So I think as a prerequisite to having multiple tracers, we need to have an aggregator first.
That brings up an interesting side note. USEC Rio has always been for aggregating and interoperability. Now that we have you and Sherwin on the line, how hard or how easy would it be to make your 2 systems interoperable?
For me, it shouldn't be hard. The data set's the same, diba? Subject, location, time, exposure period. It's really not hard. I think it's really more the mindset of people getting to a point that there's no data in contact tracing that's bad. It's just a matter of having a good aggregator and good analytics platform to deliver those as insights.
Salamat po.
Okay,
Thank you.
salamat, Sherwin. Kevin, would
Hi,
you like
Kevin.
to jump in, Kevin?
I apologize. I've had like 3 other meetings at the same time. But I have been tracking your diagrams, and in many cases, when we've done, we do cybersecurity and data privacy. So we look at things a little bit differently than a normal person would. And a lot of these apps, a lot of these systems do contact tracking versus contact tracing. And I noticed on several of your slides that you had, you're reporting back to a central database, correct? Your information goes, it gets processed and stored in a central database. And who controls that database? Who has access to that information?
Yeah, so the database is sharded. The aggregator of the database for RapidPass is the Department of Information Communications, Telecommunication. But then it's sharded in that the identity of the allowed persons outside of residence is manifesting only on the approving agency's database, so the 32 database. So we do maintain separation of data from the purpose of disaggregation as a practice, right? That way you can have one system and you still need to have the other one to complete the information. But they're all government domain at this point.
Are you familiar with trust boundaries?
Yes.
Okay. The DICT is a wide open system. They have very little protections against people penetrating their systems. And so so my question is, if you have this massive database and you get more and more data, and it has to do with location, people movement, condition of people. I didn't notice. Do you have any PII, personally identifiable information, other than tracking?
No, the PII are minimized. It's really, in fact, we limit it to a mask between the QR code control number and a phone number. And the PII is retroactively constructed on an incident basis only.
When I do, what is a cryptographic QR code? I've been a cryptologist since.
Yeah, so what we do is we have a shared secret between the database that produces the QR code and the decryptor, which is the phone. So if you use the shared secret as a decryptor to SHA-256 dataset, then you have zero brute force capable QR system, so that you can put the data payload on the QR itself and have some confidence that they will not be reverse engineered.
But I'm assuming that somebody with a scanner, if I want to go into Dagupan, or Dagupan wants to use that QR code to allow me in or out because they're in a lockdown based on information in the DICT database of whether I've been contacting, you're tracing me with contacts or without contacts or whatever. That QR code is the Dagupan's gateway into me.
Correct.
Right?
Mm-hmm.
Okay.
Yeah.
All right. So the cryptologic part of this is just between your database and the phone.
And
Correct.
it's
But
a
that
single
QR
shared
code,
key, Sir Winston? Or do
Uh,
you alter it for every mobile phone?
well, there are actually one shared key between the parties and two local keys that are algorithmically generated on the endpoints.
Hmm.
on the phone.
The phone and the server.
Okay. So maybe it wouldn't be a nice idea to get Winston to reveal in public all the
Yeah, and
cryptographic secrets.
that's all. That's all I can
Hackers
say.
would be listening in and breaking this pretty soon. So yeah, so there are cryptographic keys, and Kevin is the expert there. He's the cryptologist. That's what he
Right.
did in the U.S. Marine Corps.
Mhm.
How many wars did you see? The Korean War, the
Oh.
Vietnam War, and
Let's not go back to the Korean War. No, Vietnam.
We are going to date Kevin today.
Yeah. Well, I um, I was there for the launch. The internet started in 1969. I was on the internet in 1973.
Very cool.
So I'm
ARPANET.
yes, I am a senior citizen, but the questions I ask actually have to do with protection of people that are using your
Mhm.
system.
Yep.
And now we use Novid, which doesn't
Mhm.
use any PII, and it's a relationship between me and people that my phone can see, that app can see.
Mhm.
As soon as you start involving DICT, and that's where everything's going to be kept. And DICT is going to be the organization that responds.
So
Like
let's let's
in
take a
the
step back,
scenario
Kevin.
that I built that I
Yeah.
want to get into.
Wait, hang on, Sir Kevin. Let's take a step back. Are we in fact sure that the DICT is now the data controller of the Safe Pass system, or is it still under Talino or DevCon?
Yeah. So let me clarify the data lineage, right? The data owner is always the end user. The data controller is the one that sets context by which I ask information for, right? So for RapidPass, the data controller is the authorizing agency to allow that person to leave their home. So it could be BSP, it could be Department of Finance, it could be, if you're a bank, it could be DOH if you're a hospital. So they control the reason by which they ask data from you. I need your information about who you are so I can let you through a checkpoint. So that's the data control that they do. The PIP, the processor, is the ICT in this case. But the controller has always been the authorizer of the action relating to the collection of data. So that's the government agency for RapidPass. For Stay Safe or for SafePass, the controller of data is the business to which you're asking permission to enter.
Okay. So if the user owns the data, is there a facility there where a user can say, I want to delete all of my data in your system, or I want to export that system out because I'm the user, I'm the owner? Is there such a facility to do that?
On SafePass, the end user has the ability, because they provide consent, the expectation of consent includes delete me forever. So that's for SafePass. For RapidPass, invokes 12F and 13E sections of the data privacy law. That means that your data that you freely gave in the use of a pandemic response can be consumed for the purpose of allowing you through checkpoints, then that's a contract between you and the government. So it's a little bit different. But having helped write IRR of these things, we've implemented this to the teeth from a standard standpoint. And we did do a community hack into the systems, white hat, preventive and proactive white hacks into the system.
So does that also include the PIA, privacy
Yep.
impact assessment?
Yeah,
Who did the PIA for safe entry?
So we're very, very blessed again. PJS Law, one of the leading law firms in the Philippines for data privacy, actually wrote the PIA before we wrote software. You know, it's always the other way around when developers write software and then, oh, by the way, we need a PIA. We actually did, the first thing we did was negotiated the PIA because we wanted to understand the traversal of data, not just the controlling and processing of the data, but the traversal of data and the appropriateness of the amount of data collected for the purpose intended for it to use. So we did that. I think that's, and we got really good help from PJS Law to draft that. We partnered very closely with the Data Privacy Commission, and that's before we wrote code. After that, we wrote code.
Yeah, there's a question coming on the Facebook Live channel from June San Juan. He says, hi, who can use the RapidPass.ph?
Anyone. It's built, donated by DevCon for the Philippines and anybody in the world. It's been open sourced in the Apache software license. We obviously do not provide the cryptographic keys. We need to generate that with you as you use it. The version that's used in NCR PNP is governed by the ICT. But if you want to create an instance deployment for your LGU or for your business, then I can point you to the repositories by which you can download the app and then put it on Amazon and go.
Okay, follow-up question. This one comes from Santillan Christopher. He claims that he applied for RapidPass on April 30, and despite several follow-ups until May 5, until May 21, I'm sorry, he got a response that RapidPass no longer accepts any application. And so I asked what LGU or branch of government he was dealing with, and it seems that he says we have both applications, NTC and DTI. Can you shed light on this one?
Yeah, unfortunately, Wilson, those happened. I think the model of RapidPass is the technology allows you to apply. It queues your application to a government agency. A government agency needs to approve it. And for one reason or the other, they might lack supporting data set, or for some reason you're not on their list. And so they don't automatically grant your APOR, which is the approved person outside of resident status.
Well, this seems worse because the claim from NTC and DTI, according to Santillan Christopher, is that these agencies don't process anymore.
No, that's not true, actually. I think they were just not, I think that was just not approved for one reason or the other. And I apologize for, I think 100 or 200,000 people that actually kind of went through that application did not get it. But that was the rule of the game, right? A government agency needs to approve your ability to be outside of homes. Sometimes also, ano lang, hindi ma-verify yung kanilang OTP, the email don't go through.
Okay. Okay. Thank you for answering that. We have time for one last question, guys. One last questions. Before we let Winston Damarillo go, any last questions? Let me check the Facebook page of Manila Bulletin Tech News to see if there are questions following up. Sherwin, go ahead.
Yes, one last question. Sir, regarding po sa one per household na validation, paano na-validate ni RapidPass yung mga ganon? Kasi yun yung isang validation na failed to address actually. Yung one per
so yung the authority to validate the one per household is actually the barangay captain or the barangay staff. As far as I understand it from an LGU standpoint, no. And so just like what we did in Relief Agad, there's always a puno ng pamilya in every household. And then that puno ng pamilya can designate sino yung allowed to leave the the home, no, for emergency supplies in a situation of an ECQ lockdown. So sila yung magbibigay ng ano, sila yung magre-request at sila yung bine-verify ng local government unit representative. They can either be visited in person or they make a phone call.
I see.
Nandun na po yung sa system, sir, yung one
Nandun
per
na po.
house.
Yeah, it's got a system to process that na. And then you'll get your QR, one per household.
Okay, salamat po.
Okay, and with
Thank
that, Sir Winston, any final parting words that you can share with our loyal followers?
So Wilson, maraming salamat to you for staying vigilant and constantly being very caring about this problem. Coronavirus is a group work. It's a group problem. We all need to all cooperate to help
Together.
and together. And I think I really still echo the call to let's get as many tracers as we can functional, and let's have a system that can aggregate them. It's the only way that we can catch up to the needs of contact tracing here in the country. Thank you, Wilson.
And with that, we close our session today. Let me give my personal thanks to Sir Kevin and Sherwin for joining us.